GOP eyes wrap. Zeldin run for governor amid Cuomo nursing home scandal. We have to make the changes. Cuomo proposes his own nursing home reform package. Cuomo scandal rocks world and other commentary. Son of Brink's robbery victim disappointed in DA's push to free lawman's own killer dad. Cuomo has repeatedly defended his administration's directive for nursing homes to accept COVID-19 patients as the product of federal guidance, even though one of those government documents says only that infected seniors can be admitted to the. In contrast, the health department's since-rescinded, March 25 memo left little wiggle room to prevent medically stable patients from being transferred out of hospitals to nursing homes. During this global health emergency, all NHs must comply with the expedited receipt of residents returning from hospitals to NHs, the state directive said. And if there was any doubt about what that meant, the following sentence was underlined: no resident shall be denied readmission or admission to the NH solely based on a confirmed or suspected diagnosis of COVID-19. But a March 13 memo from the U.S. Center for Medicare and Medicaid Services, which the health department has cited as justification for its order, contains a Q&A on that very. When should a nursing home accept a resident who was diagnosed with COVID-19 from a hospital? A nursing home can accept a resident diagnosed with COVID-19 and still under transmission-based precautions for COVID-19 as long as the facility can follow CDC guidance for transmission-based precautions. If a nursing home cannot, it must wait until these precautions are discontinued. The directive, which cited an urgent need to expand hospital capacity, came under immediate fire from three healthcare industry groups: AMDA-The Society for Post-Acute and Long-Term Medicine, the American Healthcare Association, and the National Center for Assisted Living. In a March 29 statement, the organizations said they were deeply concerned with the underlined portion of the order. This is a short-term and short-sighted solution that will only add to the surge in COVID-19 patients that require hospital care, they said. A former federal health and human services official also told the Post that it was a potential recipe for disaster. Cuomo made this blanket requirement, and some nursing homes may have not been prepared to have these patients and may have caused cross-contamination, the ex-official said. And on Thursday, a draft report by the Empire Center for Public Policy tied several hundred and possibly more than 1,000 nursing home deaths to the March 25 directive, which it said is associated with more than 1 in 6 of 5,780 nursing home deaths statewide between late March and a day earlier. Cuomo vehemently defended the policy, saying, "My health experts don't believe it was wrong, and that if they did, I would sue the federal government for mal." He stood by the policy again Friday, but at neither time explained why he rescinded it under fire on May 10 and instead ordered that anyone being admitted to a nursing home had to first test negative for the. Health Commissioner Howard Zucker, who issued the March 25 directive, cited the March 13 Center for Medicare and Medicaid Services guidance during Friday's. He inexplicably quoted a portion that says, nursing homes should admit any individuals that they would normally admit to their facility, including individuals from hospitals where a case of COVID-19 was slapped. Zucker went on to refer to the part that says nursing homes can accept infected patients, noting that the need to follow transmission-based precautions was very. Zucker further read aloud from a March 23 guidance from the U.S. Centers for Disease Control and Prevention, saying, the COVID-19 patients from hospitals should go to the facility with the ability to adhere to infection prevention and control recommendations for care of COVID-19. Preferably, patients would be placed at a facility that has already cared for COVID-19 cases, he added. Zucker noted that when he issued his order, the state was running out of ICU space because hospitalizations were doubling every 3 days. With the facts that we had at that moment in time, it was the correct decision at that moment in time.